Project Impact Diabetes, amazing experience. It was, the staff and the team that we worked with was phenomenal. I really value how forward thinking and how advanced APHA Foundation has always been, and really value that experience because many things happen, right? So it gave us really great insight into things that we all have on our radar, but don't necessarily always think about early on. So the very structured and well thought out questionnaires really prompted a lot of great discussion with our patients, which we have later incorporated and continue to practice.
Project Impact Diabetes for us was huge. I'd been in the clinic for probably maybe 4 or 5 years before that. We were involved with a lot of patients with diabetes, but being involved with Project Impact Diabetes allowed our pharmacy team to start to get more of that referral base. Became a little bit more operationalized instead of just being like, oh, there happens to be a pharmacist here right now, can you help? It allowed us to move towards these collaborative practice models. It allowed us to provide more education to our medical residents as they're all rotating through there, to spend time directly with a pharmacy team and a physician side by side, providing care to these patients with diabetes and allowing them to see, it really is more than just medicine.
Project Impact Diabetes and the funding that we received from the APHA Foundation to sort of launch this helped us be creative and do things a little differently. So in our practice, I'm not just a member of the team. Our diabetes, so we have a full day at our West Grace Health Center for diabetes, and we treat patients with diabetes during that time, and that's our clinic day. And so they come in for just diabetes care, and those patients are seen by the provider, the physician, and myself. So we go into the room together and provide care together. So you hear a lot about shared medical appointments where it's sort of one provider and then the other provider, but this is actually a joint appointment where we're in the room together with the patient, helping the patient and helping the patient meet their goals together. And so we were able to create this model based on Project Impact Diabetes.
Project Diabetes was super impactful in my career, one, because it definitely helped to support the work that I was doing at El Rio. And then to this day, it's just continued to really build on itself. We've, as a result of that project, added more pharmacists to the practice. We were able to expand services. A lot of the pharmacists that work at El Rio are now certified diabetes educators, which is great, especially because we have a diverse group of clinicians that are represented and that help to represent the population we serve.
When we did the Project Impact program, I saw how there are other stimulus and how food and these other resources played such an important role in the motivation of the patients, and also how it helped them overall in their diabetic care. So that gave me a realization that the scope of care needed to be larger than just drugs and monitoring them.
That whole concept of diabetes can't wait. So, don't leave today's work for tomorrow, and please don't leave it for a month or 3 months from now. That is also a huge lesson learned from that experience with Project Impact Diabetes that I took home and that I regularly think about.
It also got us very prepared for when value-based contracts started to come into our primary care clinic. There was already a model in place that they were aware of to be like, oh, we should have our pharmacist helping with some of these diabetes metrics. So that all kind of led to these automatic referrals and this collaborative practice and the stuff we have today, where again, our pharmacy team is managing. If it's an A1C above 9%, it goes to our pharmacy team, and we kind of are taking the lead on the management of that patient until we get them under better control.
So it's just really been astounding to see the impact of Diabetes Impact from the foundation and what it's done for our practice and just how it's helped our patients.
I always think about Project Impact Diabetes as really helping to launch a wonderful initiative that has only grown and that continues to grow to this day. So that's how I look at it now, and other opportunities that have happened as a result of that. We're doing a lot of work on even going beyond diabetes to diabetes prevention, and then again going from type 2 to type 1 and leveraging things like new tools like continuous glucose monitors, things like that are always evolving. So a lot of that effort is really, it planted a seed for what's become a forest of opportunities, and definitely a forest for where pharmacists can then help create care models and help expand opportunities to help patients have better outcomes.
But one of the other huge values of being involved in Project Impact Diabetes was the ability to connect regularly, not only with people who are incredibly talented and innovative from APHA Foundation, but also the amazing innovators in our community that are working with patient populations similar to ours.
Numerous stories of our patients and the impact of the program that's been built off of our original sort of diabetes impact from the foundation. And many of our patients will come into class and say, this has saved my life, to be able to get my diabetes under control.